Welcome friends to CNS Viewpoint. Today we are going to talk about a very important news which we read about South Korea. If you remember in CNS Viewpoint we had discussed this probably in February 2022 that the South Korea is among those countries which had successfully maintained a very low caseload number of COVID positive cases, despite having a very strong health system, very good disease surveillance system, and very high vaccination rate. 87% of its population is fully vaccinated months ago, and 63% of its population has also got booster doses. Uh, uh, the number of new COVID infections and has been contained and has remained contained comparatively low if you compare it with similar population size in other countries around the world, barring very few exceptions. So this was really commendable, and but things have not gone in the right direction, and very recently South Korea is reporting extremely alarming number of cases. I was so shocked to read over 600,000 new cases, 620,000 or something new cases in 24 hours in South Korea, and over 10 million new cases, active cases in a population of 50 to 60 million, 50 million if I remember correctly. So almost 1/5 of the country's population is already confirmed to be with the active COVID, and same is in United Kingdom. If I remember correctly, I was hearing lecture or talk of Dr. Campbell, and he said that 20% of the population has COVID-19, and that is just amazing to in UK. So this is same here in South Korea, and this is so very alarming. And imagine 10 million new cases in a population of 50 million, and 600,000 cases in a day. And I must say the strength of disease surveillance system, because if we compare it with India reported, if I'm correct, if I'm wrong, please correct me in the comment section, that India reported the highest peak probably in the Delta wave, not in the Omicron wave. So just imagine the underreporting. In the Delta wave, our highest peak of number of new infections in 24 hours was in April 2021. I think it was about 450,000. So in a population of 101.4 billion, we reported 450,000 in 24 hours last year in April. And South Korea is reporting now with Omicron dominated wave 620,000 new cases in 24 hours. That's the peak. But after that, I read that there was a decline, which is thankfully, and the numbers were about 400,000, which is still very, very high. And let us hope that because of very high vaccination, 87% of fully vaccinated people, 63% with boosters, number of hospitalization, oxygen, ventilator, or untimely deaths do not happen at all, as far as possible. And so basically, as public health experts have been saying, that if we have very good vaccination rates, we can take out the pandemic part of the COVID-19, which basically means people may get infected with COVID-19 but may not need hospitalization, oxygen, ventilator. And this has been the case in Omicron wave, if we see from different countries, including India, that the data shows that over 90% almost, this has been the data from most of the parts of the world, that including India, that over 90% and some almost 90% or more or less, different places, different data, but almost 90% of the people who needed hospitalization because of COVID-19 in Omicron wave were unvaccinated. So it was predominantly an epidemic of or a wave where people who were needing hospitalization, oxygen, ventilator, or intensive care help were unvaccinated. And this is really important to a reminder that we need to boost up vaccination, make sure people are fully protected. Those who need booster should get it, and we need more science to show that we with any further doses of booster will actually help in protecting people from serious outcomes of COVID-19. Of course, let us not forget not to do everything possible in breaking the chain of transmission of this infection. Um, um, Basics are very important. Wear a mask, maintain social distancing, use sanitization, and get vaccinated when your turn comes. Do everything possible to keep your loved ones, your colleagues at your workplaces, people you travel with, in public transports or in public places, social life, economic activities. Let us try our level best. Let us try to reduce the transmission. It is really very important to break the chain of transmission, and we should not compromise it while we are opening up and going ahead with economic activities, which and rightfully so. So, with these words, I will end today's CNS Viewpoint. My prayers for South Korea and every other country which is dealing with another surge of COVID-19 in March 2022. This is alarming. We really, it's more than 2 years of the pandemic. We all wish it to go away. We do not want anyone to get hospitalized, sick, or dealing with long COVID. And of course, even one death because of COVID-19 is a death too many. Uh, with these words, I will end today's CNS Viewpoint. Tomorrow again, I will be back at 5 p.m. India time with the thoughts and views and perspectives on something that made us think. Bye till then. Take care.